Hi everyone, my name is Diana Kopian, and today I will be talking about the epidemiology of Staphylococcus aureus colonization in nursing home residents. Staphylococcus aureus, also known as S. aureus, is known as a type of bacteria that stains gram-positive. It is a small, round-shaped or non-motile cocci that is non-moving. The reason why it is called Staphylococcus aureus is because it is found in grape-like clusters. Staphylococcus aureus is one of the most common causes of infection after injury or surgery. In American hospitals annually, Staphylococcus aureus affects around 500,000 patients. S. aureus is also known as an issue in nursing homes, involving patients who do have an indwelling catheter and also involving patients without an indwelling device or catheter. This article has been done to study the clinical and epidemiologic characteristics of Staphylococcus aureus colonization and how it has emerged in community nursing homes. The research was done on different types of indwelling catheters, and research was focused more on extranasal colonization. The hypothesis of this research was that individuals with indwelling devices will have a higher chance of getting Staphylococcal aureus or MRSA at multiple extranasal sites, rather than a patient who does not have an indwelling device in a nursing home. The methods that the researchers used were 213 residents from 14 different nursing homes, and the residents either did or did not have an indwelling device, and they were all put into the research. The samples were gathered from oropharynx, the nares, groin, perinatal area, wound, and internal feeding tube sites. The microbiologic methods used were electrophoresis, PCR detection of Panton, Valentine leukocidin, and SCC-MEC and AGR typing. The results of the research show that 131 out of the 213 residents in nursing homes were positive for Staphylococcal aureus colonization. Nares cultures had the highest positivity rate for S. aureus. 11 different types of MRSA were colonized in the residents by the various different types of methods that I mentioned. It was concluded that extranasal colonization involving MRSA was seen frequently among nursing home residents, more specifically in patients with indwelling devices or catheters. Nursing home is for individuals that are not required to be at a hospital but need some sort of extra support that the family cannot give them or provide them in their own comfort of their own home. So the nursing home is a way for patients to get better and get extra help. It's not a way to spread any sort of bacteria to the patients that go in who are clean and don't have any of these bacteria. It is important for public health professionals to educate the public about ways to decrease the chances of catching Staphylococcus aureus, specifically in nursing homes. This article did not provide information on how to avoid catching the bacteria, and so extra research should be done in figuring out the link between Staphylococcus aureus and patients with indwelling devices. Since this article did not provide information on how to prevent Staphylococcus aureus in nursing homes, I did some extra research on the side to find out how to prevent S. aureus. I came to realize that professionals and researchers are not able to find a link between the two. Many of the articles mention that there has been a lack of study in providing information on what to do in nursing homes to avoid this type of bacteria in patients with indwelling devices. Although there is no actual proof on what to do to avoid S. aureus, I think it is always very important to use infection control practices to avoid any type of bacteria, and even specifically this one. This study showed outcomes that were easily predicted, stating individuals with indwelling devices had a higher chance of developing S. aureus rather than patients who did not have an indwelling device. It was shown that out of the indwelling device sites used, including oropharynx, nares, groin, perinatal area, wounds and internal feeding tube sites that the Nairs had the highest percentage of residents who colonized in Staphylococcus aureus. This is important information because it will help the public in doing extra research in the Nairs and how to stop the bacteria in residents with indwelling devices, and possibly even find the link between the two. As future nurses, I think it is very important to use infection control practices as a way to try to avoid bacteria in any type of setting, whether it be in a nursing home, hospital, home health, or even a hospice care. Staphylococcus aureus in nursing home is a big deal because families send their loved ones to nursing homes to care and to stabilize the resident, not to spread any type of bacteria or infection. This article was interesting to me because my uncle is actually the owner of a nursing home, and I was interested in finding out extra information that I can pass down to him. I made sure to inform him about the possibility of S. aureus in patients with indwelling devices, and I strongly believe that it is important that researchers extend their research and try to find the link between Staphylococcus aureus in patients so a cure can be found, so we can stop the bacteria from spreading into nursing home patients who do or even don't have indwelling devices. Thank you for listening to my speech, and I hope you enjoyed it.